There will be a decision soon, in fact it's imminent, tonight or tomorrow morning, on indoor gatherings. This number of 100 people has been raised and suggested. Do you think that's a good number, and how might that affect schools?
Well, look, Patricia, I'll wait to see what the medical health experts have to say on this. Obviously, the government is taking their advice on these measures, so that will ultimately go to the National Cabinet, the Cabinet of the Prime Minister, all the state premiers and the territory leaders, and they will look at that advice and ultimately make a decision. So I'm sure that the health experts will look at the pros and cons, at what stage we are in terms of the virus spread, and make the best scientifically informed decision in the best interests of our nation. I'm happy to put my faith in that.
Minister, the details here are changing day to day, as you know. So should Australians expect, when they wake up tomorrow morning, new guidelines on their gatherings, particularly indoors?
Well, once again, that will depend on what the medical health experts have to say, and then ultimately what the National Cabinet decides. So we'll just have to wait and see. But what I can say to the Australian people is that this pandemic continues to evolve, and therefore the government's decision-making has to evolve with it. And of course, the medical experts have to reset their advice accordingly. And that's the way it's worked basically since late January, and it's the way it's going to continue to work. Now, I understand that does create some uncertainty, but that is how you deal with this type of pandemic. It's the best way to do it. Listen to the medical experts, allow them to advise you as the virus continues to progress, and that's the best way that we can keep people safe.
Let's talk about your portfolio, schools, education, of course. Donald Trump has called on parents to school their kids from home if they can. Parents seem to be doing that in Australia to some extent. That's the parents that can. Is that helpful? Is it helpful that some parents have voluntarily withdrawn their kids from school?
Well, ultimately, that's a decision for parents to make.
Is it helpful, given one of your chief recommendations has been this social distancing? That's effectively what parents who are doing this are producing. Is it helpful in terms of health outcomes?
Well, the medical experts have said at this stage the best thing is for children to be at school. And they've said that for two reasons. One is that they think it's better outcome for our workforce at the moment, because we need all our nurses, our doctors, allied health professionals, our scientists and everyone else able to go about their work. The second reason is that often in terms of childminding, the elderly have to step in to help with parents who have to go to work, and that can prove a risk to the elderly. So that's the two reasons that they've given at the moment. The government has supported that, state and territory governments support that, but ultimately in the end parents will make decisions according to their wants and needs, and I think we've got to respect that as well.
Do you understand their motives for withdrawing their own children from school?
Oh, look, I understand this is incredibly concerning time for parents. I understand it's a concerning time for teachers, for whether they be in our schools, whether it be our early childhood workforce, in our childcare centres. This is a concerning time for everyone, for principals. Principals are having to make very tough decisions as well. So we understand that this is a concerning time. We understand that people will make decisions based on a number of factors. We also trust the common sense of Australians, but what the Australians can be reassured of is that the government is listening to the best medical advice that we can get, and it's renowned internationally in the decisions that we are taking.
Is there a way where you could keep schools operating at a sort of skeleton level for children whose parents are frontline workers. You've identified it as a workforce issue rather than a health issue, that these parents need to continue to work. So is there a way where you could essentially reduce drastically the number of children at school by allowing the school to continue to function for the parents who clearly need the school to function?
Well, it's a workforce issue and a health issue, Patricia, because there's that element of often the elderly having to come in and do that childcare minding, which then makes them vulnerable. So we have to understand that medical advice is on two fronts. But when it comes to the workforce, one of the things that schools can do, and some independent schools, as I understand it in New South Wales, have done this, is said that they're going to move to online studying. But what they will do is keep the school open so that if any student needs to come to school to do that online studying or online learning, they will do so under supervision. So that will enable those workers who can't find other arrangements to be able to still go to work knowing that their children are being looked after. So that, to me, seems a very sensible thing to do if you're not going to leave your school open.
Is there a point in time at which school closures, whether they be mass or targeted, will be inevitable?
Well, ultimately, in the end, that'll be a decision for the medical experts. They'll make that and then advise government accordingly. So that decision hasn't been made. But as we've seen across the globe, some countries have moved in that direction and taken that decision. Some countries haven't. We'll be guided by the medical experts. They're looking at what's occurred in other countries and what the consequences have been around those decisions, and they'll then use that expertise as well as the expertise they're putting in place regarding pandemic planning that they've been doing and watching the spread of the virus, and they'll make decisions accordingly. And contingency plans are being put in place. You know, I've said on a number of times that, you know, I know that state and territory education ministers have been planning for a number of arrangements, and that is just good, sensible planning. It's the sort of thing that the Australian people should expect, and we'll listen to the advice of the medical experts and then decisions will be made accordingly.
Minister, with respect, I think that Australians watching will want to know what some of those contingencies might look like. I mean, I'm a parent, I know you are too.
Yep.
Parents are really confused at the moment, and there hasn't been enough clarity around what this might look like. So let's get specific here. Is one thing on the table extending the Easter school holidays, making them start earlier? Is that actively being considered now?
Look, all those provisions have been looked at. So I've said before that some of the things you might look at is around how you stage school holidays. The other things that obviously there's work going on is online learning. Those two things are being looked at. So all these things have been discussed. All these things are part of contingency plans, as you would expect them to be.
So is it actively being considered, because the Easter school holidays, obviously in Victoria at least, begin in a week and a half? Is one thing being considered starting them a week early?
Well, when it comes to states and territories, you've got to remember that they also stagger their school holidays. So while Victoria, it's the week after next, it's later in New South Wales, and then it's later in the NT. So this is why all these things need to be considered. It's actually one of the real benefits of having the National Cabinet, because all states and territories can come together with the Prime Minister, and all these things can be looked at, and there might be individual decisions that states and territories need to take because of the various circumstances in their jurisdiction. But the best thing we can do is try as best we can is get a unified national approach, and that's what the National Cabinet is seeking to do.
And when I asked you about a skeleton model, is that being actively considered as well, the idea of being able to provide school where you can attend for the children who need it, and a different model where you have, essentially you reduce the contact points?
Well, all these things have been part of planning and looking at contingencies. So there are a number of scenarios that you always need to look at when you're putting in place plans, and all those scenarios have been looked at. Obviously, for different states and different territories, there will be different arrangements that they need to consider, have to take into account. For instance, Patricia, one of the things that also we need to consider is that you've got after school care often that takes place at schools. So what happens around decisions taken by schools, what's the flow on impact to after school care? So all these things need to be looked at. They're all being looked at, and then decisions will be taken at the national level to try and get uniformity so that we can give that certainty to parents as best we can. But I do have to say, and I've got school children, you've got school children, because these pandemics evolve, because we're in uncharted waters, that the decision making will have to continue to evolve as a response. And that's just good, sensible governing.
Just in terms of the other part of your portfolio, of course, universities, you're constructing a second stimulus package, will be rolled in essentially into the first, given things have deteriorated even further in the last few days. Universities have been hit hard. Are they going to be included in this stimulus package?
Well, the government will look at a lot of sectors, and I'll be meeting with the UA board tomorrow, and I'll be talking to them about the types of things that might help and support them through the coronavirus. Likewise, I've been talking to state and territory education ministers with schools. I've been talking to the childcare sector to make sure also we're putting the plans in place to help and support them as well. So those discussions will continue, and we will be doing what we can to help and support everyone in the education sector, like we'll be trying to do the same with the aviation sector. Now, whether that's in this next iteration of the stimulus package or in the budget or in future measures, who knows? But we will continue to do everything we can to support the education sector through this.
So in terms of the education sector, can they expect to be part of the next stimulus? Is this imminent, or are you saying they may have to wait?
Well, Patricia, we'll wait and see. Obviously, there's decisions and discussions going on at the moment about what we've made with the first stimulus package, and then how we will look to add to that as necessary. I will continue to have discussions with the childcare sector, with state and territory education ministers, with the university sector, and where we can make decisions. It might not necessarily need to be part of a stimulus, an additional stimulus measure. I will be looking to help and support them to make sure that we can get them through, like we will the nation, through the impact of the coronavirus.
You mentioned childcare a couple of times, and of course at some point they may need to stop. That's also something that has been looked at. Will parents, will the centres still be able to get the subsidies flowing to them to keep them afloat? Because no doubt there will be implications for the sector.
So these are ongoing discussions that I'm having with the childcare sector. I was speaking to key members of the sector today. Officials in my office have been talking to the sector last week. So we're looking at ways that we can help and support them, like we are with the higher education sector, and like we're looking to support state and territory governments with their school sectors.
And the other part is there's a work test, a pretty stringent work test you've applied. Many parents look like they might be becoming unemployed now. Will you allow people to still keep their children in childcare if they fail those work tests because they've lost work because of this downturn?
Well, it's a work and a volunteer test as well. You can do volunteer hours, but these are all the things that we're looking at the moment, and we're in discussions.
Is that something you're actively looking at, given things are about to change dramatically in Australia?
Well, we're in discussions with the sector at the moment. They've put some ideas to us as to how they think the government could help and support them through the coronavirus. Obviously, we're considering those, and we've said that we'll be coming back to the sector shortly to have further discussions with them and then put some proposals. So these are all things that are being considered at the moment, as you would expect from good, sensible governing.
Just very briefly, a man has been airlifted to hospital from the Victorian town of Rosebud after he was reportedly stabbed at a Woolworths. How alarming is this story? I mean, we've been reporting about these supermarket wars, but this is now becoming a very, very unsafe situation.
Well, that's the first I've heard of that, and but could I just say in general, what we really need from all Australians at this time is for everyone to really look at what they can do to help and support all members of the community. This is a time we need to come together. This is a time where we need to help and support each other, and if we do that, we will get through this, and we will be bigger and stronger and better as a community and as a nation at the end of it. And I would just call on everyone to just step back, give a little bit and support each other, because that's going to be the best way we all get through this.
Minister, I know you won't know much about this. It's literally just broken. But Andrew Bragg, who is a Liberal senator, has tested positive for COVID-19 as well. This is the third federal politician to test positive. What does that say about really the increase of COVID-19 now? We've seen a steep increase in the New South Wales numbers as well.
Yeah, look, I think what it shows is that the proportionate response that we're seeing from the federal government and state and territory governments is the right one. We are starting to see the virus continue to spread here in Australia, so therefore we've got to step up our measures as a response to that, and that's what governments are doing. That's what the National Committee or the National Cabinet will look at further measures tonight. So this is not unexpected. We knew that the virus would increase in its rate of spread, and we've just got to make sure that we put the proper measures in place to deal with that, to make sure that we're flattening the curve and ensuring we get through this. And that's what the federal government and all state and territory governments are seeking to do.